I am Dr. Rajeev Sood. I am heading the Urology, Renal Transplant and Robotic Program at Fortis Hospital, Vasant Kunj. I have been associated with kidney transplantation for the last 25 years and have done more than 1,500 renal transplants. A patient whose kidneys have failed needs either dialysis or a more permanent solution, renal transplantation. A patient who has a life expectancy of more than 10 years, so you could say up to the age of 70, 75, one may offer a kidney failure patient renal transplantation. In India, renal transplantation is mainly a live related donor kidney transplantation, which means a family member who could be a parent, a child, a sibling, a brother and sister, or a distant relative like nephews, nieces, uncles, aunties. They could come forward and donate their kidneys. There are two parts to the renal transplantation. One is the legal part, which involves submitting the documents to the concerned government authorization committee, which decides on the veracity of the documents and approves the renal transplantation between the donor and the recipient. The medical evaluation primarily starts with a blood group match between the donor and the recipient. There is also a blood cross match which is done to ensure that there are no preformed antibodies in the recipient which could lead to rejection of the donor kidney. Today, surgery for renal transplantation is highly evolved and it is completely safe for the kidney donor. Anybody between the ages of 18 and 65 to 70 years of age can donate his kidney. We have to carry out certain tests to judge the function of the donor kidneys, and if there is adequate renal function, then one kidney from the donor is taken and added to the recipient's body. Donating a kidney comes with no risk in terms of long-term health or longevity. Today, the kidney donor surgery, called the donor nephrectomy, is carried out both by open surgery as well as by laparoscopic surgery. We in our hospital routinely do laparoscopic live donor nephrectomies. The donor has a small cut the size of about 2.5 to 3 inches on one side of his body, based on which kidney has been removed. He is in hospital for 3 days, at the end of which he does not need any medication nor any significant painkiller drugs, and post-surgery he could travel back to his city or his country within 5 to 7 days. Once the recipient is discharged after renal transplantation, the requirement of drugs slowly comes down to a maintenance level by around 3 months. The remaining medicines continue for life, and as far as the cost every month is concerned, is roughly between $100 to $150. This expenditure the patient continues for life. As far as the clinical outcomes of renal transplantation are concerned, today both surgery and the immunosuppression drugs are so safe, and there is significant experience in our hospital. At 1 year, the graft survival and the patient survival are close to 99%, which means of every 100 transplants done at 1 year, close to 99% of the kidneys would be working. However, when we talk of a transplant kidney's life, while a kidney can continue for the rest of a patient's life if he is regular with his medication and prompt in treating any other illness, generally the global average for current kidney transplant programs varies between 12 to 15 years. A kidney failure patient can undergo 2 to 3 kidney transplants in a lifetime. The younger the patient, the greater is the need to carry out a renal transplantation so that he can go back and live his life as a normal individual and be able to contribute to society. Kidney transplantation has thus become the mainstay of treatment for end-stage renal disease. A patient with end-stage renal disease who needs a kidney transplant would be counseled by his nephrologist on the need for renal transplantation. The initial investigations of the patient and his donor would have been carried out under supervision of his local nephrologist or nephrologist. These investigations the patient can send to our hospital through email, and our international team would get back to you with the suitable details on the fitness of the donor and the recipient, and would also share the expense structure and would also inform you about the legal requirements in terms of papers that you would have to carry from your country when you come to India for a renal transplantation. A rough timeline from the time you travel to India and undergo the transplant and are ready to go back to your country would generally be around 6 to 8 weeks. So when you start, you need to factor that kind of time period to come, get investigated, have your legal documents cleared by the Government Authorization Committee, undergo the surgery, be on follow-up till such time you're considered safe to travel back to your country and then be under the care of the nephrologist or the nephrologist in your country. Thank you.